Hello everyone, Michael Ferrara, your Medicare agent, and it's time for Medicare AEP, which brings newspaper ads, radio ads, mailbox explosions, your phone ringing off the hook, because everyone wants to sell you a Medicare plan. Should you decide to listen to them? No! Here's why. If you're on a Medicare Supplement plan, that is guaranteed renewable for life. What that means is you don't have to do anything with your Medicare Supplement plan. Now, your Part D drug plan changes every year. Many good choices for 2018, as many of the premiums are actually coming down, formularies are expanding, and tier costs are coming down as well on some of those plans. So now is really a great time to review your Part D drug plan, as you should review it each and every annual election period, which runs October 15th to December 7th. If you have a Medicare Supplement plan, and if you received good advice from the very beginning and are on Plan G for most states, which is the best plan to possibly be in, your renewal date for your Medicare Supplement plan could be any time of the year. Maybe you turn 65 in July. This would make your renewal in July every year, which means during January or December or October, nothing changes. You don't have to do anything. You want to look at your plan to compare it to other carriers out there when your renewal time comes around, which typically you'll receive your rate increase letter 45 days before your renewal. Rates will typically adjust up every year no matter which company you have. You'll want to contact us when you see a huge jump so we can look at the marketplace again to see if the premium you're paying versus what the other carriers are charging. We'll also need to ask you some health questions to see if you will qualify for that new plan, because unlike Obamacare and all the other under age 65 plans, over 65 Medicare Supplement plans still rely a great deal on your health condition, and you'll need to answer no to a series of health questions before you'll be able to apply for that new plan. Medicare Advantage HMOs, PPOs, where you have to go through a certain restricted network of doctors and hospitals, you have to pay huge copays if you're admitted into the hospital, and you're restricted by their network. Medicare Advantage plans have no underwriting or health questions to answer. However, you pay for it when you go to use those plans, and some plans could go up to $6,700 if you have anything major going on while you're on that Advantage plan. With the Medicare Supplement plan, you're protected as long as you continue to pay your monthly premium. They cannot cancel you from the plan, no matter what health problems you're going through, no matter where you decide to move in the country, you get to keep your Medicare Supplement plan. The only question is, have you received a rate increase lately? Is that rate increase significant enough to call us to shop the market again to see if there's a better alternative right now? Every month it seems there's a new company coming in and they are giving us their information saying, hey, we're a brand new to the marketplace and we've got better rates. This is good and bad at the same time. Sure, you could probably save a few dollars by always chasing the lowest rate. However, in my experience, the best thing to do is to look at changing plans only when you get your rate increase notice and it's a significant enough rate increase, and most of my clients will tell me, no, I'm happy where I'm at, I'm going to stay where I'm at because it's only a $4 or $5 per month rate increase, and that's to be expected with most plans out there. However, we look at where you started to, where you're at now, and if you have a significant jump, we need to look at the marketplace again, which you can always give our office a call and we'll be happy to review this with you. And if you receive our voicemail, please leave a message as we will call you back once we're done helping out another client. Now, keep in mind, moving you to a new plan will require asking some health questions, submitting your application to underwriting to determine if you'll be approved for that new plan. If you're not approved, we will keep you on your current plan. With your Medicare Supplement plan, there are no annual election periods. They are set in stone and you don't have to do anything, as they will automatically renew each year. The only time you need to do anything with your Medicare Supplement plan is if you are receiving a significant rate increase. Even when you are moving from one state to another, you keep your original Medicare Supplement plan because it's a plan much like a life insurance policy, where if I buy a life insurance policy in Illinois, but then I move to Florida, I keep my same life insurance policy. I don't have to give it up and get a new one, which is good because it's based on your age. Same thing with your Medicare Supplement plan. If you got a really good plan and you move, you will not lose your plan. If you enjoy traveling, you know that your Medicare Supplement plan gives you the greatest amount of freedom and flexibility to see any Medicare provider across this great country. With the Medicare Advantage HMO, you are so tightly limited to their network unless you go to a PPO plan where when you are out of their network, you're going to pay a higher level for everything that you do. Now, there are some good Advantage plans out there and can be a good fit for some seniors. However, in my opinion, Medicare Supplement plans are still the best. This is the busiest time of year for one reason. The media's big news about now is the time to shop your Medicare plan, and for those folks on Medicare Advantage plans, you have to look at your plans each and every year because plans can significantly change. You want to look at your annual notice of change that you get late September for your Medicare Advantage plans, which will go over your new copays, check to see if your doctor and hospitals are still on the network, did your max out of pocket go up, etc. Give us a call to schedule a time to go over this with us, and we will also look to see if there's a better plan available for you for the upcoming year. If you're on a Medicare Supplement plan, you don't have to do anything, but if you'd like us to shop the market for you, give us a call and we'll be honored to see if we can help. My advice is always free. Let me help you look at Medicare Supplement rates when you get that rate increase notice. That is the best time to look. It only takes a couple of minutes, and if we identify a new company for you, we also have to ask a few questions to see if you'll qualify those plans. And we have access to those health questions, so we don't waste your time applying for a new company that you would not qualify for. As long as you're honest with me about your health situation, it's not a gray area, it's black and white. Have you had this condition? Have you had that condition within the last 2 or 3 years, or ever if something major? With that information, we'll know if you have a chance to be approved or not, saving us both time and frustration. Either you can go to a better plan or you can't. It's that simple, but at least we can provide those options for you. Again, your Part D drug plan falls under the law in Medicare known as Part C, the Medicare Advantage plans. So they do change every year. They can change their formularies, their networks, their deductibles, and all that kind of stuff. In my office, we only write one Part D drug plan. If that happens to be the one that works best for you, great, because it's a national plan, it's the biggest, and year after year it has a high star rating, which is very important when you're looking at your Part D drug plan. I want to personally thank you for spending a little time with me today. I hope you found this information useful, and if you have any questions or I can help you in any way, please give my office a call at 815-254-0340 or send me an email and I'll be happy to help in any way that I can. My name is Michael Ferrara and I'm your Medicare agent with Ferrara Services. Thank you again for watching, and I hope you have a great day.